some people get PTSD but others don't?
So if we look at risk factors for PTSD, the things that people arrive at the event with make a small difference. So females, for example, are a bit more likely to get PTSD. People who are, let me think of some other examples. People who've had a history of difficult events are a bit more likely to get PTSD. People with a history of psychological problems are a bit more likely to get PTSD, but they're not big risk factors. The bigger risk factors are how big or bad the event was. Bigger than that is what the person thinks of the event. So were you afraid, were you fearful for your life, is a bigger risk factor than an objective measure of how big or bad the event was. And then the things that happen afterwards are even bigger risk factors. So lack of social support for children, social withdrawal is a big risk factor. Families breaking down and not working well together is a risk factor. Deliberately thinking of something else to stop those memories coming in is a risk factor. And also how well your parent doing is an important risk factor. So if the parent is really struggling, then that seems to contribute to the child's PTSD. So the good news about that is there's lots of things we can do to help families function well, to help the person feel supported, to make sure the adult, the carer, gets the help that they need, and that's going to have an impact on the child.
If PTSD is left untreated, what can that do to a person later on?
Well, it becomes their personality rather than just a reaction to the event. So they may become incredibly cross and lose their temper very easily. They will still have those intrusive images. If you look at the disaster in Aberfan in Wales more than 30 years ago, 30 years later, 30% of the people there still have PTSD.
Remind us what happened?
So Aberfan is when in a mining community, a big slag heap slipped into a school playground, killing some children and teachers. Now 30 years later, those 30% of them still have PTSD, a problem for which we have pretty effective interventions. But because people don't share, they don't talk about it, they don't want to admit they've got difficulties, they deny themselves the opportunity to get the cure, to get the intervention that helps.